So I want to finish by talking about sort of a niche product that's wildly popular again as a result of social media, and that's these acne patches. So where do you guys stand on this, Katie? I know you've probably posted about it several times.
It's funny when it first came out, I was like, where are we going
Yeah.
with this, right?
Nah.
Because it's not like what we had traditionally learned or taught around, putting something all over for prevention, turning over
Right.
the skin cells, right? Like as we would
Right.
talk
It
about with the
defies what
retinoid,
we
et cetera.
preach.
Right. Spot treatment
Yeah.
is not what we do. But I am a fan overall now in that I think it is useful in a few ways, right? It occludes the spot, it can wick away a little bit of that fluid. It blocks
Yes.
picking, which especially
Bingo.
in the teen tween, like it's so tempting. It's there, the picking. We see a lot of acne excoriae or excoriated acne
Mhm.
lesions, which means they picked at it. And so I do think that that is helpful to prevent some of that post-inflammatory change, potential scarring. And now, like you'll see it, teens, they're like wearing them like
Yeah, they
badges of
like wear them
honor. Like,
proud.
oh, I know,
Exactly.
like what is happening? Like everyone's just wearing them, and I'm like,
Let's
well,
just
you know what?
normalize this. Could we just normalize it? I think it's so cool. So many kids have acne and it can be so stressful.
Right. And
Yeah,
so
I
this
love
is
that.
something that feels like they're doing something.
Yeah,
It's active. So I'm on board with it, and I think there's a role for sure.
I agree. I'm sure you use them as well, Latanya.
I absolutely love them, especially the non-medicated ones, because it's really that hydrocolloid
Right.
that's going to promote faster healing. So if they did get at something, we're going to try and minimize the scarring, really discourage the touching and picking that we just spoke about, which is
Yes.
huge. And again, the psychosocial component, you're right. I find in my practice that there's kids that the younger generation that are really, the heck is in my hand? Sorry. The younger gen, okay.
You
The
coloring
younger
with the
gen,
kids today
I
at the
guess so.
office?
Bringing the office home. The younger generations that wear proud and proudly, but there's still pimple patches out there that are really nice where if you want a discreet coverage where it's more tan complected, and
Yes.
those are lovely because the older kids don't necessarily want to have these colorful shapes all over their face.
No.
And I love when there's a variety of sizes that Neutrogena has for say, where you can
Right.
think about it. We do still get back acne. So for larger areas, or if you need a smaller discreet, so the different sizes are helpful,
Hmm.
if you have a small blemish on your nose. But I absolutely love them. You can have fun with them and they really do the job well. And, this is where I have the conversation with the preteens, the teens that, acne, I just normalize it that we have acne because for the majority, they're going through healthy pubertal changes. And this is not about being perfect. Social media drives this, perhaps flawless skin. We need to be perfect. We can't have a blemish. And so this says, blemishes, breakouts
Okay.
are normal and we
Hmm.
can manage it and we can protect your skin while it's healing. And again, a lot of those pickers I see are the type A students, the ones that are driven for perfection, the ones that really get really good grades. I can't tell you how many times when I hear that they're picking or scratching, I'm like, oh, I bet you get great grades, you're straight A's. And they're like, yes. So I think these
Oh,
definitely have a role in our management for acne.
I think so too. I agree with you. The Neutrogena patches with the two sizes makes it really nice. And they did some nice little studies with it, as they always do. And 8 out of 10 kids said that they weren't picking because they were using the hydrocolloid patches. Yeah, I mean, that's probably the best thing that they do. They also do reduce the lesion itself, as you know, fairly quickly because they're occlusive, but just to stop these kids from excoriating. And you're right. I mean, these poor children who are looking for perfection. I mean, I tell my grandkids, I'm like, that's a filter, guys. These people have filters on. Everybody in your classroom, look around your room, and everybody has a couple little pimples just like you do. And it's
That's why they
so,
love Snapchat. I think that's
oh,
like the intro because
I
they love the
know.
filters. It's so
I know.
fun, it gets them in that